Welcome to Psych IQ. In this note, we explore agoraphobia, a debilitating anxiety disorder that affects millions worldwide. 1. Defining agoraphobia. Agoraphobia is not just a fear of open spaces. It's a complex anxiety disorder characterized by a fear of situations where escape might be difficult or help unavailable in the event of a panic attack. These situations can include crowded areas, public transportation, or even leaving home alone. Agoraphobia is not just a fear of open spaces or crowds. It's a deeper anxiety about being in places where escape might be difficult or where help might not be available if panic strikes. Picture this. You're in a busy shopping mall, the noise and chaos surrounding you, and suddenly, a wave of intense fear washes over you. This fear isn't about the mall itself. It's about the anxiety that comes from being in a setting where you feel trapped and powerless. Agoraphobia often leads to avoidance behaviors. Some people with severe agoraphobia find it difficult to leave their homes, while others might be able to visit familiar places, but avoid venturing into new or unknown areas. The condition is unique to each person. Some might be able to go to a nearby grocery store, but not to a crowded market, while others might be able to visit one relative's house, but not another's. Understanding the root of agoraphobia requires looking at what people fear most, the onset of a panic attack. This fear of panic, rather than fear of specific situations, drives many of the behaviors associated with agoraphobia. People with this condition often worry about what would happen if they were to have a panic attack in public. How would they get help? Would they be able to escape? Would they be judged by others? These questions can be overwhelming and lead to significant limitations in everyday life. Despite being one of the most common anxiety disorders, agoraphobia is often misunderstood. It's not about a fear of the market, crowds, or airplanes. It's the fear of what could happen if panic sets in while in those situations. The fear of losing control or not being able to leave can be so intense that it dictates where a person goes and what they do. Treatment for agoraphobia typically involves therapy, such as cognitive behavioral therapy, CBT, which helps individuals understand their thoughts and behaviors around anxiety. Exposure therapy is also a key component, gradually desensitizing individuals to the situations they fear most. Medication can be prescribed to help manage symptoms, but therapy is often the cornerstone of treatment. Living with agoraphobia can be a daunting challenge, but it's important to remember that it's treatable. With the right support and coping strategies, individuals with agoraphobia can gradually reclaim their freedom and start to engage with the world again. If you or someone you know struggles with agoraphobia, know that you're not alone and that there are effective ways to manage and overcome this condition. Now it's your turn. If you have personal stories or insights about agoraphobia, share them in the comments below. Let's keep the conversation going, learn from each other, and support those who are navigating this challenging condition. 2. Symptoms and manifestations. The symptoms of agoraphobia can vary in intensity and may include panic attacks, rapid heartbeat, sweating, trembling, dizziness, and a feeling of losing control. Those with agoraphobia often experience anticipatory anxiety, fearing the onset of panic attacks in specific situations. Agoraphobia can present a wide range of symptoms, impacting both the body and the mind. These symptoms can vary greatly from person to person, with some experiencing mild discomfort in certain situations, while others suffer from intense, debilitating fear that disrupts their daily lives. Here are some common symptoms and manifestations of agoraphobia. Physical symptoms. Individuals with agoraphobia often experience a variety of physical symptoms, especially when confronted with a situation that triggers their anxiety. These symptoms may include rapid heartbeat, a sudden increase in heart rate, often described as feeling like your heart is racing or pounding in your chest. Sweating, excessive sweating, particularly on the palms, face, or underarms, even in cool environments. Trembling or shaking, uncontrollable shaking of the hands, legs, or entire body, which can make it difficult to perform everyday tasks. Shortness of breath, difficulty breathing, or a feeling of not getting enough air, leading to rapid, shallow breaths. Dizziness or lightheadedness, a sensation of the room spinning or feeling faint, often accompanied by nausea. Stomach upset, gastrointestinal distress, such as stomach pain, cramping, or nausea, particularly when faced with an anxiety-inducing situation. Psychological symptoms. In addition to physical symptoms, Agoraphobia can cause significant psychological distress. These symptoms might include intense fear or panic, an overwhelming sense of fear or panic, often triggered by being in public spaces, crowded environments, or situations where escape might be difficult. Anticipatory anxiety, anxiety that builds up in anticipation of facing a potentially challenging situation, leading to avoidance behaviors. Fear of losing control. A common concern is the fear of losing control in public, which can lead to embarrassment or humiliation. Fear of being trapped. The belief that you won't be able to escape or get help if needed, which can lead to an overwhelming sense of vulnerability. Depression and isolation. The fear of panic attacks and avoidance of certain places can lead to social isolation, depression, and a loss of interest in activities that once brought joy. Behavioral manifestations. People with agoraphobia often change their behavior to avoid situations that trigger anxiety. These changes can include avoiding public places, steering clear of crowded environments, such as shopping malls, concerts, or public transportation, staying close to home, limiting travel to familiar locations, or refusing to leave home without a trusted companion. Creating safe zones, defining specific areas or places where the person feels safe, and avoiding locations outside these boundaries. Reliance on others, depending on friends, family, or caregivers to accompany them when leaving home or going to public places. Interference with daily life. Agoraphobia can severely impact work, school, and social activities, leading to a decreased quality of life. Understanding these symptoms and manifestations is crucial for recognizing agoraphobia and seeking appropriate treatment. By acknowledging these challenges, individuals can take steps toward managing their condition and regaining a sense of control over their lives. 3. Causes and triggers. Agoraphobia can stem from various factors, including genetics, brain chemistry, and life experiences. Traumatic events, such as experiencing or witnessing violence, can trigger the development of agoraphobia. Additionally, individuals with a history of panic disorder are at a higher risk. Agoraphobia, often seen as a fear of open or public spaces, has a complex set of causes and triggers that contribute to its development. While the exact reasons vary from person to person, understanding these factors can offer insights into why agoraphobia occurs and how it can be addressed. Let's explore some of the common causes and triggers that can lead to the onset of agoraphobia. Genetic factors. Research suggests that agoraphobia can have a genetic component. If you have a family history of anxiety disorders, you may be more likely to develop agoraphobia. While genes aren't the sole cause, they can increase your susceptibility to anxiety and related conditions. This genetic predisposition might interact with environmental factors, creating a higher risk for developing agoraphobia. Brain chemistry. Imbalances in brain chemicals, such as serotonin, dopamine, and norepinephrine, can play a role in the development of agoraphobia. These neurotransmitters help regulate mood, anxiety, and stress responses. When their levels are disrupted, it can lead to heightened anxiety, which in turn may trigger agoraphobia. This chemical imbalance is often why medications like antidepressants are used to treat the disorder. Traumatic experiences. Trauma, particularly during childhood or adolescence, can be a significant trigger for agoraphobia. Experiencing or witnessing a traumatic event, such as violence, abuse, or a severe accident, can create a heightened sense of vulnerability. This trauma can lead to a fear of being in situations where you feel unsafe or unable to control your surroundings. The trauma might also be linked to the onset of panic attacks, which can further contribute to agoraphobia. Panic disorder. Many people with agoraphobia have a history of panic disorder, which is characterized by recurrent panic attacks. A panic attack is a sudden surge of intense fear or discomfort, often accompanied by physical symptoms like a racing heart, sweating, or dizziness. When these panic attacks occur in public or open spaces, they can create a lasting fear of those situations, leading to agoraphobia. The fear of having another panic attack can drive avoidance behavior, reinforcing the cycle of anxiety. Environmental and social factors. Your environment and social context can also influence the development of agoraphobia. If you've grown up in an environment where overprotectiveness or social isolation was common, you may be more likely to develop agoraphobia. Additionally, significant life changes, such as the loss of a loved one, divorce, or a major illness, can trigger anxiety and lead to the onset of agoraphobia. These environmental and social factors can create a sense of instability, contributing to the fear of leaving a safe space. Learned behavior and avoidance. Agoraphobia can also be a learned behavior. If you repeatedly experience anxiety or panic attacks in certain situations, you might begin to associate those places with fear. This learned association can lead to avoidance, where you start to steer clear of places that trigger anxiety. The more you avoid these situations, the stronger the association with fear becomes, reinforcing the agoraphobia. In summary, agoraphobia is a multifaceted condition with various causes and triggers. Understanding these factors is crucial for developing effective treatment strategies and helping individuals reclaim their lives. By addressing the root causes, you can begin to break the cycle of fear and move toward a more open and fulfilling existence. 4. Impact on daily life. Agoraphobia can significantly impair one's ability to carry out routine activities, leading to social isolation, dependency on others, and difficulty maintaining employment or relationships. The fear of experiencing panic attacks can confine individuals to their homes, limiting their engagement with the outside world. Agoraphobia can have a profound impact on daily life, often disrupting a person's ability to live independently, maintain social connections, and pursue career opportunities. The degree to which agoraphobia affects everyday activities varies from person to person, but the overall effect is a significant reduction in quality of life. Let's explore the various ways agoraphobia can influence a person's day-to-day living. Social isolation and loneliness. One of the most immediate impacts of agoraphobia is social isolation. People with agoraphobia may avoid public places or social gatherings, leading to fewer interactions with friends and family. This isolation can create a cycle. The more a person stays at home, the less they interact with others, leading to loneliness and a sense of disconnection from the world. Difficulty with routine tasks. Agoraphobia can make even the most routine tasks seem daunting. Simple activities like grocery shopping, attending appointments, or picking up a prescription can trigger intense anxiety. This can lead to a reliance on others for basic errands, further reducing a person's independence. As a result, individuals with agoraphobia may struggle with maintaining a consistent daily routine. Impact on employment and education. Agoraphobia can also hinder a person's ability to work or pursue education. Fear of leaving the safety of home, using public transportation, or interacting with colleagues and classmates can lead to frequent absences or even job loss. This can limit career prospects and impact financial stability, creating additional stress that exacerbates the agoraphobia. For students, agoraphobia might result in poor academic performance or dropping out of school. Dependence on others. Because agoraphobia can make it difficult to venture out alone, those who suffer from it often rely on family members, friends, or caregivers to accompany them when leaving home. This dependence can strain relationships and create a sense of guilt or helplessness. It can also limit personal growth, as the person may struggle to build autonomy and confidence in managing their own life. Emotional and mental health challenges. The impact of agoraphobia on emotional and mental health can be profound. The constant fear of panic attacks, combined with social isolation, can lead to depression, anxiety, and low self-esteem. This emotional toll can make it even harder to break the cycle of avoidance and seek help. Additionally, the stigma surrounding mental health issues may discourage individuals from reaching out for support, further isolating them from potential sources of help. Decreased physical health and activity. Agoraphobia often leads to a reduction in physical activity, as individuals may avoid going outside for exercise or leisure. This decrease in activity can contribute to weight gain, muscle loss, and other health issues. The lack of physical exercise can also impact mental health, as exercise is known to reduce stress and improve mood. This decline in physical well-being can create a vicious cycle, where poor health further diminishes the motivation to leave the safety of home. Limited access to healthcare and services. Agoraphobia can make it challenging to access healthcare and other essential services. Routine medical checkups, dental appointments, and other necessary healthcare visits can be daunting, leading to missed appointments and neglected health issues. This lack of access to healthcare can have long-term consequences on overall health and well-being. Agoraphobia can significantly impact a person's daily life, affecting their social connections, employment, education, and overall health. The far-reaching effects of this condition underscore the importance of seeking professional help and support to manage and overcome the fear associated with agoraphobia. With appropriate treatment, individuals can work towards regaining their independence and rebuilding their connections to the world around them. 5. Diagnosis and treatment options. Agoraphobia is a complex condition that requires a careful approach to diagnosis and a tailored treatment plan. Addressing agoraphobia involves understanding the unique challenges each individual faces and providing comprehensive care to help them manage and eventually overcome their fears. Let's explore the process of diagnosing agoraphobia and the various treatment options available to those who experience it. Diagnosing agoraphobia. Diagnosis typically begins with a thorough evaluation by a mental health professional, such as a psychiatrist or psychologist. The process involves detailed discussions about the individual's symptoms, medical history, and behavior patterns. The mental health professional will look for specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to determine if a person has agoraphobia. These criteria include persistent fear or anxiety. The individual has a lasting fear or anxiety about specific situations like public transportation, open spaces, enclosed spaces, crowds, or being outside the home alone. Avoidance. Behavior. A tendency to avoid these situations or require a companion to feel safe. Duration. The fear or avoidance lasts for 6 months or longer. Impact on daily life. The condition significantly interferes with work, social life, or other daily activities. Disproportionate fear. The level of fear or anxiety is disproportionate to the actual threat in the situation. The mental health professional may also assess for related conditions, such as panic disorder, to determine if there is an underlying cause for the agoraphobia. Once the diagnosis is confirmed, the treatment process can begin. Treatment options for agoraphobia. There are several treatment options available for agoraphobia, each tailored to address the specific needs of the individual. The most common treatments include cognitive behavioral therapy, CBT. CBT is a highly effective treatment for agoraphobia. It involves working with a therapist to identify and change negative thought patterns and behaviors that contribute to fear and avoidance. CBT helps individuals understand the triggers of their anxiety and develop coping strategies to manage them. A key component of CBT is exposure therapy, where the person gradually confronts their fears in a controlled and supportive environment. This can help desensitize them to anxiety-inducing situations. Medication. Medication can be a useful tool in managing the symptoms of agoraphobia. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed to help reduce anxiety and improve mood. In some cases, benzodiazepines may be used for short-term relief of acute anxiety symptoms. It's important to work with a healthcare provider to determine the best medication and dosage for your needs, as well as to monitor for side effects. Virtual reality, VR, exposure therapy. This emerging technology allows individuals to experience simulated scenarios that trigger their agoraphobia, providing a safe space to practice coping techniques and gradually build confidence. VR exposure therapy can be especially useful when real-life exposure is impractical or too distressing. Group therapy and support groups. Connecting with others who share similar experiences can be a powerful tool for overcoming agoraphobia. Group therapy sessions allow individuals to share their struggles and successes, offering mutual support and encouragement. Support groups provide a sense of community and can reduce the feelings of isolation often associated with agoraphobia. Lifestyle changes and stress management. Managing stress and improving overall well-being can have a significant impact on agoraphobia. Incorporating relaxation techniques like mindfulness, yoga, or deep breathing exercises can help reduce anxiety. Regular physical activity and a healthy diet can also contribute to better mental health. Developing a treatment plan. A comprehensive treatment plan for agoraphobia should be customized to meet the unique needs of the individual. This plan may involve a combination of therapy, medication, and lifestyle changes. The key is to start with manageable steps and gradually build confidence as progress is made. It's crucial to work closely with a mental health professional to track progress and adjust the treatment plan as needed. The diagnosis and treatment of agoraphobia require a holistic approach that addresses the underlying causes and provides practical solutions for overcoming fear and avoidance. With the right support and treatment, individuals with agoraphobia can regain control of their lives and re-engage with the world around them. 6. Coping strategies and self-care. Coping with agoraphobia involves developing personalized strategies to manage anxiety and gradually expand one's comfort zone. This may include relaxation techniques, mindfulness practices, setting realistic goals, and seeking support from loved ones or support groups. Self-care is essential in maintaining mental and emotional well-being. Coping with agoraphobia can be challenging, but effective coping strategies and self-care practices can help you manage anxiety, reduce avoidance behavior, and gradually reclaim your independence. Let's explore some of the best ways to take control of your life while dealing with agoraphobia. Breathing and relaxation techniques. When anxiety strikes, your body's fight or flight response kicks in, leading to rapid breathing, increased heart rate, and a general sense of panic. Breathing exercises can help you regain control. Techniques like diaphragmatic breathing, where you breathe deeply into your abdomen, can signal to your body that it's safe to relax. Pairing these exercises with guided imagery or progressive muscle relaxation can create a powerful calming effect. Mindfulness and meditation. Mindfulness involves focusing on the present moment without judgment. By practicing mindfulness, you can reduce anxiety and stay grounded even in stressful situations. Meditation, which involves focused attention and awareness, can further enhance your ability to stay calm. Apps like Headspace or Calm offer guided meditation sessions, providing an easy way to integrate mindfulness into your daily routine. Physical activity and exercise. Regular exercise is a proven stress reliever that can help reduce anxiety and improve mood. You don't need to run a marathon. Even a short walk can make a difference. Find an activity that you enjoy, whether it's yoga, dancing, or swimming, and aim to make it a consistent part of your schedule. Exercise releases endorphins, which are natural mood boosters, and can also improve sleep quality and overall health. Build a support system. Coping with agoraphobia can be isolating, but building a support system can make a world of difference. Surround yourself with understanding friends and family who encourage you to step out of your comfort zone at your own pace. Support groups, whether in person or online, can connect you with others who understand what you're going through. Sharing experiences and learning from others can boost your confidence and reduce the feeling of being alone in your struggle. Set achievable goals. It's easy to feel overwhelmed by agoraphobia, so setting small, achievable goals can help you make progress without feeling discouraged. Start with tasks that are slightly outside your comfort zone but still manageable. For example, if you're nervous about leaving the house, begin with a short walk around the block. Gradually increase the distance or frequency as you build confidence. Celebrate your achievements, no matter how small, as they indicate progress on your journey. Develop a safety plan. Having a safety plan can reduce the fear of the unknown and provide reassurance when you're out in public. This plan might include emergency contacts, relaxation techniques, and a list of coping strategies for when anxiety arises. Knowing you have a plan in place can make it easier to venture out, knowing you have resources to rely on if needed. Practice self-compassion. Agoraphobia can lead to feelings of frustration or self-doubt. Practicing self-compassion means treating yourself with kindness and understanding, even when things don't go as planned. Remember that recovery is a journey with ups and downs, and it's okay to have setbacks. Treat yourself as you would a good friend. Be gentle, encouraging, and supportive. Create a comfortable home environment. If you're spending more time at home due to agoraphobia, creating a comfortable and calming environment can help reduce stress. Consider adding elements that bring you joy, like plants, artwork, or soft lighting. A clutter-free space can also reduce anxiety and create a sense of calm. Use this environment to practice relaxation techniques, mindfulness, or other self-care activities that help you feel at ease. Seek professional guidance. While self-care and coping strategies are essential, seeking professional guidance from a mental health expert is crucial. A therapist or counselor can provide personalized advice, track your progress, and offer support as you work through your fears. don't hesitate to ask for help when you need it, as agoraphobia is a challenging condition that benefits from professional expertise. Embrace progress, not perfection. Finally, remember that progress is more important than perfection. Agoraphobia doesn't disappear overnight, and every step forward is a victory. Embrace your journey, and don't be discouraged by setbacks. By consistently applying coping strategies and self-care practices, you can move toward a more open and fulfilling life, one step at a time. 7. Breaking the stigma. Despite its prevalence, agoraphobia is often misunderstood or stigmatized, leading to feelings of shame or embarrassment for those affected. It's crucial to challenge misconceptions surrounding mental health disorders and promote empathy and understanding. By fostering open dialogue and offering support, we can create a more inclusive and compassionate society. Breaking down. Agoraphobia, understanding and conquering the fear. Imagine walking into a busy train station, only to feel your heart racing and a surge of panic washing over you. This isn't just nervousness. This is agoraphobia, the fear of being in situations where escape seems difficult or help might not be available. I'm Dr. Tracy Marks, a psychiatrist here to discuss agoraphobia, what it means, and how you can overcome it. Let's dive into what makes agoraphobia such a challenging condition, and more importantly, how to find your way back to feeling free and in control. Agoraphobia's roots. Where does it strike? Agoraphobia often centers around 5 key situations that trigger intense anxiety due to the fear of being trapped. These situations include public transportation. Buses, trains, or airplanes can be daunting when you're unsure if you can handle a sudden wave of panic. Open spaces. Parking lots, shopping malls, or wide-open parks can evoke a sense of vulnerability. Enclosed spaces, small rooms, theaters, or elevators can make you feel claustrophobic and unable to escape. Standing in crowds, concerts, festivals, or even long queues can feel overwhelming. Being alone. Outside home. Venturing beyond the safety of home can seem impossible without a trusted companion. The panic connection. When fear takes over at its core, agoraphobia isn't about the places themselves. It's about what might happen there. Many people with agoraphobia fear having a panic attack and not being able to get out or get help. Take Tom, for example. Tom gets dizzy when he feels anxious, and he's worried he might faint or throw up in public. This leads him to avoid office meetings and social gatherings. For others, the fear might stem from falling or becoming incapacitated. It's not the fall itself, but the worry that no one will be there to help. Chronic nature and the impact on life agoraphobia can be debilitating. More than a third of people with agoraphobia become entirely homebound, unable to work or lead a normal life. It's often associated with panic disorder, where panic attacks are frequent, and the fear of having one in public drives avoidance behavior. But agoraphobia can also occur on its own, separate from panic attacks. Regardless, the common thread is the overwhelming anxiety that leads to isolation and limits your freedom. Finding help. Therapies that make a difference. If you're battling agoraphobia, there's hope. Cognitive behavioral therapy, CBT, is a cornerstone of treatment. With CBT, you work with a therapist to confront and reframe the thoughts that fuel your anxiety. A popular technique within CBT is exposure therapy, where you gradually face the situations you fear, step by step. This isn't about jumping into the deep end. It's about creating a plan with your therapist to tackle your fears at a pace that feels manageable. Another key aspect of CBT is cognitive restructuring, which helps you identify and challenge distorted thoughts. For instance, you might have a tendency to catastrophize, always assuming the worst. Through cognitive restructuring, you learn to reframe these thoughts into more realistic ones. Medication, a helping hand on the journey. For some, therapy alone is enough to manage agoraphobia, but in more severe cases or when quick results are needed, medication can play a vital role. Antidepressants like Zoloft or Lexapro can help reduce anxiety over time, while benzodiazepines like Klonopin or Ativan can offer short-term relief while antidepressants take effect. Your psychiatrist can guide you through these options and help you find the best path to recovery. Regain your freedom. Steps to a better life. Agoraphobia can feel like a cage, but you don't have to stay trapped. With the right support, whether it's therapy, medication, or both, you can start to reclaim your life. Take small steps, build your confidence, and soon you'll find yourself exploring places you never thought you could. As we conclude our exploration of agoraphobia, we invite you to share your thoughts and experiences in the comments below. Let's continue to educate ourselves and others, fostering empathy and support for those navigating the complexities of mental health. Stay tuned for more insightful discussions on Psych IQ.